Hi, I'm Dr. Terry Silkman. Lucy and I are going to ask the question today, how much can you afford to pay for your health care, and what do you want to pay for your health care? Well, there's obviously no shortage of debate on that these days with the ACA and the non-ACA, and are we going to keep the ACA or are we going to replace it with something else? Obviously, people are focused a lot on the cost of health care, at least to a certain perspective. And in the veterinary field, fortunately, we don't have those concerns to have to deal with in the sense of the huge debates back and forth about cost, but I think it's worthwhile for us to talk about some perspectives, and I'll share them from the perspective of a veterinarian, and then maybe try to ask a few questions about how they would relate to you and I and the decisions we make about health care. You can see that Lucy's a little less interactive this morning than she normally is. She's recovering from hysterectomy that I did on her yesterday. You would know it as the lay term spay. And even in the veterinary profession, there's a huge debate about, well, should we spay and neuter pets, and where did that come from? Well, it kind of came from years back when we saw tons and tons of unwanted pets and lots of unfortunate euthanasias that were happening because of the out-of-control pet population. And unfortunately, that still lasts today. But I would give you a perspective in terms of the value of hysterectomy and neuter. In fact, there are lots of studies out there. I think they're somewhat difficult to interpret, but there is a study out there that would suggest that neutered and spayed pets outlive non-neutered and non-spayed pets by 2 to 1. And again, not to spark a debate among my colleagues or other people who look at things, I would absolutely positively take issue with the fact that spay and neuter by itself increases the length of life by a 2 to 1 margin over non-spayed and non-neutered pets. I think owner selection, I think owners that would buy better diets, that would do better preventative health care probably in years past and maybe even today are more likely to be owners who would spay and neuter their pets. So I think anytime you quote statistics from studies, you have to be somewhat careful about what is the perspective that the study came from. But I will give you some perspectives of a veterinarian who's practiced nearly 30 years. We have debates in our profession about numbers of vaccines and whether we should whether we are over-vaccinating or whether we are under-vaccinating pets. We have debates, and you would see some of my colleagues that would argue that the endocrine or the hormonal imbalances from spay and neuter would be detrimental to a pet's health. You would have veterinarians or colleagues of mine that would say that there's absolute evidence that in some pets over-immunization contributes to poor health problems. And I would agree to a certain extent with those perspectives. And yet, in the 30 years that I have done what I've done, I've tried to keep in mind, and I actually shared this with a new client yesterday, that the greatest value that I believe I can bring to you as a pet owner and to your pet is the prevention of disease. And just to give you a perspective, hysterectomy, wherever it's done, if it's done under what I would call reasonable and safe state-of-the-art conditions, might be several $100s, somewhere between probably $200 and $500, depending on where you're at and what you do. And yet, the value of doing that is that most people don't understand there's much bigger diseases that can occur that you can prevent from sterilization than just the concern about unwanted pregnancy. For example, because of differences in reproductive physiology, unspayed female dogs, especially medium-sized to larger unspayed female dogs, have about a 30% or a 1 in 3 likelihood of developing an infected uterus. That, like your infected appendix, if you don't deal with it, creates loss of life. Basically, the uterus will become full of infection and it will rupture at some point if it's not dealt with, and the pet will succumb to the effects of bacterial invasion into the system and die of sepsis. So, how can you deal with that? Well, if you're a veterinarian who believes that the best prevention of disease is to prevent spay and neuter, or to not advocate for spay and neuter and wait till that occurs, Well, I've seen multiple instances where things like infected uterus, things like being faced with cure of parvo disease, things like having to deal with substantial hit-by-car injuries, and other types of procedures far exceed the owner's motivation or their resource to deal with the problem. So, in the sense of the value of preventative medicine, a couple of $100 spay in a patient that's an ideal anesthesia and surgery risk and is likely to do very well during the procedure and profit afterwards is, in my mind, a much better thing to do to try to help stimulate and preserve the quality of life of the pet and the pet's owner than to wait for the development of pyometra, which takes a pet in a horrible, sick, high degree of risk anesthesia situation with a high degree of cost associated with it, and try to help an owner resolve that issue. Most of the time, the issue is more difficult to resolve and many times, unfortunately, will result in either the pet dying of the problem or being euthanized because we don't have in a very short time the ability to marshal the resources that it takes to deal with that. In fact, several years back, I did a cost comparison of a lot of preventative medicine things. For example, the cost of doing a series of parvo vaccinations for a puppy might run, in a worst case scenario for you, 4 visits at about $200 to $250. That would be very high, and I would say would exceed most of the time what you would pay. Cost of treating parvo, probably somewhere between $800 and $1,500, depending on how sick the pet is and what you have to do to fix it. We've already mentioned the cost of an elective spay under ideal anesthesia conditions, $300 to $400. The cost of taking a dog that's got uterine infection that's sick through surgery and recovery, probably somewhere in the range of $1,000 to $2,000. So my best asset, or my being of best asset to an owner in the sense of preservation of life of the pet, preservation of quality of life of the pet, preservation of the relationship between the owner and the pet, lies best accomplished in preventative medicine. Segue that into what we talk about to you in human health. You can debate all you want about whether ACA is the better way to go, whether non-ACA is the better way to go, how many hundreds of dollars, thousands of dollars. For Chris and I, works out to be about $1,700 a month that we pay for our health care, even if we don't go to the doctors. For many people, that would be a blessing. For many people, what they have allowed is the same type of process that we've just discussed, is they've ignored or marginalized what good diet, what good supplementation, what good preventative medicine could do for their health. And they do it because of their perception in the short term of cost, or they do it because they don't know what the information is, or they do it because they believe it can never happen to them. And unfortunately, that is always the challenge in preventative medicine, is we're conditioned to think about dealing with the problems that are most immediate. And whenever something is working well, the thought process can very naturally gravitate toward, well, I'll deal with it someday, or I don't have to deal with it, or I just don't care to deal with it. I guess I would say you don't have to pay any attention to me at all, but my whole career, I started as a farmer where my job was to make things grow and prosper, little bitty seeds and little bitty animals to grow and prosper. I actually picked a second career that seems to mirror that, which is veterinary medicine, where you help things that cannot help themselves and make decisions, try to prosper and maintain and regain health. And that's essentially what we do in the other business that we're dealing with now. It's a health and wellness platform, and we believe strongly in the value of health and wellness. So, this is Dr. Terry Silkman. I'm a nutrition and weight loss expert, veterinarian of 30 years, highly focused and highly knowledgeable in the value of preventative health care. If you'd like to know more about what we do, you can reach out to us. Our website is www.silkmanteam.com. and you'll find a wealth of information there about things that you can do to prevent disease processes from coming, and there's no question that the value of prevention is at least 5 to 10 times or 5 to 10 times less than what the cost of cure is. Until next time, Dr. Terry Silkman wishing you a life lived in sixth gear, whether you're 30, 40, 50, or 60. Find ways to live your life in sixth gear. You'll be a lot happier than living it in third or fourth gear. Bye-bye.